Our next two witnesses together are known as Myles and Paul, are they?
Yes, sir.
Myles and Paul, please.
Please state your full name.
Myles Hutchison.
Hold the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Please state your full name.
It's Paul Hutchison.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Myles, you and Paul are brothers.
Yes,
You're the older of the two by 1 year and 10 months.
that's correct.
And you've got moderate haemophilia B.
Yes.
That was diagnosed when you were a baby.
Mm-hmm.
And there's not a family history of haemophilia, and it's been described as a spontaneous genetic mutation.
That's correct.
You were, as was Paul, and we'll come on to Paul in a few minutes, but you were under the care of the Royal Infirmary in Edinburgh from about 1980 onwards.
That's correct, yes.
You were roughly 8 years old when your care transferred there.
Yes.
Paul would have been about 6. And you came under the care of Dr. Ludlam.
That's correct.
You describe in your statement being there very frequently as a child.
Yeah, unfortunately, I was quite prone to bleeding episodes.
And we can see from records, I won't put these ones up on the screen, but that in about October 1979, your mum was invited to be taught how to administer factor to you and to Paul.
That's correct, yes.
And the records also show that over the following years, you received factor IX concentrates on a very frequent basis, prophylactically, twice weekly.
Yes, that's correct, twice weekly.
As far as you're aware, was any advice or information or warning provided to you or to your parents about any risks of infection associated with the factor IX products?
None at all. They were assured all the time that it was perfectly safe.
Do you know whether any alternatives to this twice weekly prophylactic factor IX treatment, were any alternatives discussed with your parents?
None whatsoever. They were basically told to put their trust in Professor Ludlam, and they did that, but no alternatives, even though they were there, not to our knowledge, were ever given.
You, I think, Myles, have a recollection at some stage of being shown 2 different factor IX products by Professor Ludlam and told that one was more expensive than the other.
That's correct, yes.
Can you remember how that made you feel?
I was actually in shock when he asked me. I thought it was a trick question. I thought a person of his intellect, would not ask a patient such a ridiculous question. It shouldn't come down to cost, it should come down to safety. And I just presumed that he would give me the safest option. So I said to him, well, I've always trusted you in the past, so I'll trust you now.
There was an occasion during your childhood when you went on an organised holiday to Wales.
Yes.
For boys with haemophilia, and your parents were told by Professor Ludlam not to allow you to use any factor products locally in Wales.
Yes, that's correct. He actually said if we had a bleeding episode, not to take any treatment, to actually wait till we came home and suffer the bleed, rather than take any other factor.
You were treated at the Royal Infirmary in Edinburgh in an adult unit.
Yes.
There wasn't a bespoke haemophilia care facility for children.
No, there wasn't, no.
And so you saw a lot of the time older haemophiliac patients.
Yes, unfortunately I did, yeah.
And you saw them becoming ill as the years went on.
I've seen things that no child should ever have seen. I've seen a lot of young men die and I was only 10-year-old. There was one specific boy that, that I grew very fond of because he was very friendly and he was a haemophiliac like myself, and he was like a big brother figure, sort of, you know, and they had him on a sideboard because he had HIV, and he never got any visitors because his family were all strict Catholics, and Professor Ludlam wouldn't admit that he'd received HIV through his treatment, so they were convinced that he led a life not to their liking, and they disowned him. So he was very lonely, and he became a friend. And one night, I'd been watching the TV when I was lying in the bed in the hospital, and it looked next to his room, and I saw him crying for his mum, like I'd done on many nights. And he died. His poor head went down, his hand went to the side, and I seen all the life drain out of this potential young man. And nobody looked at him or gave any attention to him, so I went over and I gave him a hug. And I said, "You're with the angels now, you'll be okay." And then I heard this trolley clattering down the corridor, so I ran back to my bed because the nurses would get angry with me if I got out of my bed. And I seen two men coming down with this big steel trolley, and they were singing "Another One Bites the Dust." And they picked up this poor young man's body, they slapped it on the tray, and it goes, "Mind no touch him, mind your gloves are on. It's just a disease, you're not to touch him." And they slammed the door shut. They caught his hand in the door, actually. I just remembered that now. And I heard like a cracking noise. I can only presume it was one of the bones in his hand. And they closed it shut and they started whistling a wee merrily, going up again. But I've seen a lot of things like that. I've seen a lot of things. But that's the one that always sticks out because he became a friend, and no human being deserves that. No.
And you would spend time talking to some of the older patients. You were still a child yourself.
Yes.
And you would be told things by older patients about American blood or blood being taken from Russian corpses.
Yes.
And that must have been, whether it's correct or not, very frightening information for a child to receive.
Well, that's the thing. Nobody ever spoke to me. They always made out, "Oh, but tell what your mum and dad have written," which I found out later wasn't the case. And I'd ask questions and I'd just get palmed off. So whenever any of the older haemophiliacs talked to you, you listened, because they'd lived with us, you know, all their lives, and you know, you would trust them before the doctors because they didn't talk to you. They didn't want to talk to you, especially Professor Ludlam. He wasn't a very forthcoming chap at all. To be honest with you, I just felt like an object when I was in the hospital. I didn't feel like a human being.
In 1984, you were told you'd been infected with hepatitis B.
Yes.
You were about 12 at that time. Had you and your parents been aware that you were being tested for hepatitis B?
No.
And we'll just have a look at a couple of documents to date this. It's, first of all, Henry, 2168002, please. And we can see there there is a date of April 1984, 20th of April 1984, and the positive result for hepatitis B. And if we can have 2168003, please, Henry. We can see here a letter sent from the Royal Infirmary of Edinburgh to your GP, diagnosis hepatitis B positive. There'd been an incident with you cutting your finger at school. And it says, as you know, he's recently become hepatitis B positive, and then describes you as a sensible, slightly obsessive child, very careful to bleed down the sink and to mop up after him, and refers to your brother being vaccinated and both parents receiving immunoglobulin. What can you recall about this episode where you had hepatitis B?
I just remember there was a phone call and my mum and dad were panicking, something wrong with Myles, and they took me up to the hospital, and it's a wee bit hazy, as you say, it's quite a while ago, but my mum and dad were very distressed because what is this? What's my son got? You know, what treatments are going to be available? What are they going to do to help him? And I just remember being put in a bed and they were obsessing about what I'd done with my blood, what had happened to me, where exactly I'd been. But as I said, I was sort of trained to clean up my own blood after me. It was a strange feeling, and they didn't talk to me much about it because I was feeling really ill. I was in a pretty bad way. But even then, there was no explanations given to my mum and dad as to how I got this virus. It was, you know, oh, this has just been an unfortunate event. We don't know how exactly it's happened. And after it was the start of me not being as well as I'd been prior. You know, I felt my health started to slide after it. And it was very distressing for mum and dad. And it seemed like it was the first page in my book that we weren't going to want to read very much. It was the start.
And you say in your statement that when your parents would ask questions of Professor Ludlam, the answers they got, your parents felt, were rather vague.
Vague, to say the least, yeah. I would actually go as far as to say he dismissed them. The questions they were asking bore no relevance to what he wanted or what he needed, so he didn't give them answers. And they make out that they reassured them and all that. I can remember my dad coming home with a leaflet in his hand, and I says, "How'd you go on, Dad?" He goes...
And we'll come on to that because I think that's when you had your hepatitis C diagnosis a number of years later. Your parents were told in relation to the hepatitis B, I think, but please correct me if I'm wrong, that your infection could have come from the first time you had factor 9 concentrate.
That's correct, yeah.
Do you know whether they were told that at the time or was that later?
What do you think?
It was later.
It was later on. That was for the hepatitis B.
Your statement suggests that it may have been in relation to both the hepatitis B and
Yes,
the
that's
hepatitis
correct,
C,
yeah.
that they were told at some stage.
They say that at some stage there was a non-A, non-B that they knew about for years. Well, try and prove that. But that they'd known about for years, and it was all related to the different viruses and that.
As you say, this was the start of you beginning to feel unwell.
Yeah.
And you describe in your statement how from, in particular, the age of 13 or 14, you would feel fatigued. You had a strange feeling in your stomach, aching joints, flu-like symptoms.
Yeah.
You also recall seeing biohazard stickers on your medical files.
That's correct, yes.
Now, I wanted to ask you a little about the view you express in your statement, Myles, that you've been the subject of being tested or researched without your knowledge and consent.
That's correct, yes.
That's your firm view.
Yeah, definitely.
You say in your statement that often during your childhood and teenager years, bloods would be taken without you being told what the tests were for.
That's correct. They took blood all the time.
And you've referred in your statement to being told something about testing for anomalies. What can you recall about that?
Yeah, I asked because back then the factor we got was in big 50ml syringes, but I had to take a lot of it. And they were taking blood out of me in these giant syringes. And they were taking maybe 4 or 5 at a time. And why do they need so much blood? And I asked them, why do I have to keep getting so much blood taken? And the nurse said, oh, it's nothing to worry about. It's just looking for anomalies, etc. It's nothing for you to concern yourself with. So.
You describe in your statement Professor Ludlam referring to you as pups.
Yeah, I thought it was a term of endearment. Actually, I was, you see, I was walking up the ward, they say, oh, here's the young pup. And I was, oh, yeah, Professor, because I looked up to him, I'll be honest, I did. I admired him. I thought he was this great figure that was helping me, that was giving me a chance at a normal life. So when he called me a pup, I thought it was, he genuinely felt that way about me as well, that it was affection. But I found out later that might not have been the case.
You found out later that there's a term of previously untreated patient.
That's correct, and
as an abbreviation.
that's what I'd heard. Or previously uninfected, I'd heard that as well, but...
You also recall on a number of occasions there being clinicians prodding around the stomach area.
Yes, that's
which
correct.
subsequently you thought may have been examinations of the liver area, and
Yeah.
that this happened from childhood onwards.
Yeah, from I was about, I'd say 13, right up until basically I got told about my hepatitis, or actually, sorry, the first time I reacted, they checked my stomach every time I went to the hospital and prodded about just under my ribs, round about the liver area, and they kept saying, do you feel anything there? No, not fine. And then one day I went, oh, that's painful, and that day they stopped doing it.
And what you've said in your statement is you feel in retrospect it was likely they knew there was something wrong, but they were waiting on symptoms emerging.
Oh, definitely. That's how I felt. I wondered why they kept prodding around my stomach. I mean, I feel like it's mostly my joints, my muscles, things like that. And they kept prodding about my stomach. Why are they obsessed? And they didn't check my joints as much, which you would expect. They kept prodding my stomach. And when they stopped doing it, I went, oh, what's that? And it was like they were just waiting to see if something would happen. They had previous knowledge of what was in my bloodstream, and they were waiting to see if it came to fruition, which it did, unfortunately.
You have a concern that you and Paul were regarded as interesting subjects for research.
Yes, that's correct.
Because you were brothers, you had the same condition, and it had occurred spontaneously in both of you.
That's correct, yes.
And it's your understanding from things that were said to you that you were regarded, the two of you, as being like twins genetically, or even though you are not in fact twins.
Well, we're actually told that we're genetically identical, even though we're not twins. We're actually more identical than identical twins. But, the features had no differences, but we're actually genetically identical inside. So I suppose if you were wanting to do any tests or research, would be perfect. It would be like gold dust, basically, because it only happens 1 in a billion, I think, something like that.
And then there was a time, this is a little later on, but it's still, I think, relevant to your concern that you've been the subject of research or studies without your consent. There was a time later on when the two of you were allocated pseudonyms by Professor Ludlam. Yeah. We'll look at the document 2168022. It's from Professor Ludlam. It's addressed to the Department of Clinical Biochemistry and headed strictly confidential. And it says this: for the purpose of clinical chemistry investigations, I've arranged the following. Paul Hutchison will be known in future as Alex Austin. Myles Hutchison will subsequently be known as Robert Marr. Neither brother knows the pseudonym of the other. Thank you for offering to archive both individuals' previous results under their new pseudonyms. Now, your brother Paul was working in the Royal Infirmary at the time.
That's correct, yes.
And we'll come on to it when I ask Paul some questions in a while. But it may have been that there could have been a good reason for giving Paul a pseudonym so his colleagues couldn't see his medical records.
Well, it makes perfect sense with Paul if he's working there to keep confidentiality for him. But why would they do it with me? There's no reason for them to give me a pseudonym. Is it a fear that I might ask for a look at my medical records, and they could quite easily give me Myles Hutchison's records? But this other chap, I'll not get to see his file, will I?
Were you told that you were being given a pseudonym of Robert Marr?
No.
And you have a recollection, as I understand it, of going to clinic appointments, and there would be two lots of files on the table or the desk or by the bed. There'd be a file with your name on and a file with Robert Marr's name on.
That's correct. Yeah.
And you didn't know why.
I thought this was a chap that always got appointments at the same time as me and decided not to go. I thought, he's awfully rude, this chap, you know. But this file was always there, so obviously, it was me, but not to my knowledge. It was.
And you have a concern that there may be medical records or studies or tests that were undertaken in respect of you, but which have been filed under the name of Robert Marr and which you've never seen.
That's correct, yeah.
You also remember being sent to hospital for injections, and when you were about 17, having injections from some large hexagonal device with lots of needles. That's how you describe it in your statement. What can you tell us about that?
Yeah, I'd got a phone call, which happened now and again at my school. They tell me I had to go up to the hospital for, blood tests or to get treatment, something like that. And this one time I went up, they said, oh, we need to take some bloods off you, and then to stop you having to get BCGs, things like that, because we don't want you to get that at the school, we'll have to do this. And they brought out this hexagonal thing. It looked a bit like a flat top comb, that sort of shape. Yeah, and it had over a dozen needles in it. And they pushed it into my arm. And it was quite painful, actually. It was really painful. And when it pulled away, it felt like it was a ripping sensation, like it was taking something with it, And I thought, this is really weird. Why do I have all these needles? I presumed in my innocence that it was an alternative to getting the BCG, so I didn't question it. But then later on, when I spoke about it, nobody had ever heard of this before, and it left some unanswered questions, to say the least.
And you've said in your statement you weren't told what this was for, despite asking.
No, when I asked, all they said was, instead of you getting your BCGs at school, things like that, we'll deal with you here, and this means you can get all done at once.
We'll look at a couple of records, Myles. 21688023, please. We can see this is a document, it's in relation to you, and it's headed Hepatitis Study. It's from 1993. And if we have then, Henry, 21688024, we can see another document with the same heading, Hepatitis Study. Were you aware of being, in any respect, the subject of any kind of hepatitis study?
I was never informed or told of any study, to my knowledge. Not that, no. But if ever I was getting blood tests, I just presumed it was normal blood tests, regular ones that we get, and I was never told I was in a particular study, no.
Henry, could we have 21688015? We can see this is an entry from your medical records, and it's the top entry we're interested in. We can see Dr. Ludlam's name at the top, and the date appears to be January 1991. If we go to the second entry under that date, it says, he is HIV and Hep B negative, but should be treated as a risk of infection. Do you know why in 1991 you were identified as someone who should be treated as a risk of infection, even though you were HIV and Hep B negative?
No.
And you think that's an entry made by Dr. Ludlam himself? You've got a recollection of, I think, of him making entries with a particular kind of fountain pen.
Yeah, it was a fountain pen he always used, and I always thought, a typical doctor's writing, you can hardly make it out, but yeah, that looks very much like his.
Could we have up on screen, please, 21688021, Henry? This is a letter, this is from November 86, so it's a few years previously. It's from the Dean of Dental Studies, and it says this. Thank you for your letter of November the 6th. It's addressed, I should say, to your GP, I think, in which you state your concerns about the way that 2 patients of yours who have a congenital bleeding diathesis have recently been treated in the dental hospital. I have every sympathy with your views and personally feel that at times we are almost overreacting to the problem of the dental treatment of high-risk patients. Pausing there, the 2 patients in question are you and your brother.
That's correct, yeah.
And you have a recollection, a clear recollection, as I understand it, of going for dental treatment in circumstances that prompted this letter.
That's
What can you remember?
It was horrendous. My dad, it was Dad that took us in.
Yeah, it was.
My dad took us up to the dental hospital we went to because of the haemophilia. They wouldn't let us have anything done at a normal dentist. And we were waiting to get seen, and all of a sudden we were taken into this room covered in plastic, and the people that were going to do our dental care had big plastic suits on, virtual hazmat suits.
Like fireman.
And we were like, what's going on? And my dad was getting real angry. The boys are nervous as it is. They're going to the dentist. No one likes the dentist, really. And we went in, and I can remember crying because they were doing this, the usual things to my mouth. But I was scared because they were all covered in plastic. And my dad was furious about it, and I think
Just took us out.
he just pulled us out and said, that's enough. But I think why it's Dr. Koonsberg there is because my dad kicked up a fuss with the GP about the way we were treated, and I think that was him reaching out to say, why are you treating these boys like they're a virus? We've no notes here saying that they've got anything wrong with them, that they should have to be treated this way, unless there was knowledge of us having something that they needed that much attention. But obviously my mum and dad weren't aware and we weren't, so it was horrendous, it was terrible.
And you were about 14 at the time, Myles. Paul would have been about 12.
Yeah.
It's late 1986. Neither of you had ever tested positive for HIV. And you weren't aware, either of you, of having been diagnosed with any other infection at this time.
That's correct. We don't have any knowledge.
And we can just see the letter continues. I would like to explain the current procedure in the dental hospital. A closed surgery has now been set aside solely for the treatment of high-risk patients. And in this surgery, all precautions are taken for the prevention of transmission of infection, with particular reference to HIV and hepatitis B virus. This involves staff being masked, gowned, gloved, and with plastic sheets on all working surfaces. A problem that then arises is the identification of high-risk patients. Dr. Ludlam has advised us that all haemophilia patients should be regarded as high-risk patients, and he does not wish us to investigate in any way which of these patients are HIV antibody positive or negative. It is because of this advice that all haemophilia patients now attending the dental hospital are treated as high-risk patients. I would hope that in the not-too-distant future a compromise can be reached in which the personal feelings of these unfortunate patients can be met and at the same time the most appropriate method of dental treatment can be carried out. I'm taking the liberty of copying this correspondence to Dr. Ludlam, and we see that at the bottom. Now, this document's come from the medical records you've received from the Royal Infirmary.
Yes, that's correct.
And the copy of the medical records that you received has this word PA, exclamation mark. If we could highlight that, please, Henry. That's possible. At the bottom, written on it.
Yes.
You have a view as to who you think wrote that.
Oh, I know who wrote that. It's Professor Ludlam. That's his P. I've seen it, so many times. He's obviously questioned, he doesn't like being questioned, his authority or knowledge or anyone interfering in any way with what he requires. And the PA is just a total disregard for what other professionals are trying to tell him.
It remains a matter of concern to you, Myles, you say in your statement,
Yes.
that there may still be samples of your blood at the Royal Infirmary that could be used for research or testing without your knowledge and consent.
That's correct, yes.
Paul, can I turn to you and ask you some questions? We've established you're a year and 10 months younger than Myles. You also have haemophilia B, diagnosed when you were a baby.
Yes.
You recall in your statement having factored treatment at home with your mum injecting you from the age of about 6 or 7.
That's right.
You've described in your statement going to the Royal Infirmary, and you say this: we always cried having to go there. The people were older, and we kept seeing them disappearing, which can be scary for children.
Yes.
You have similar memories to Myles.
Yeah, when we used to go in, you'd go in, there'd be the older chaps, and as you passed the door, I mean, some of them could hardly walk. Their limbs had been in for operations, and they were sorry looking, they were done looking. And if you'd pass the treatment door, if it was open, you'd see them sitting there. And the only way I can describe my memory, seeing what it was like a Bunsen burner tube coming out their vein, and that was them getting their treatment. But it was scary seeing this, and that we were going to have to go maybe and get this ourselves. So it was horrible visions we had of the hospital, and it was scary, really scary.
You started treating yourself at home from the age of about 13.
Yes.
When you and Myles went on an adventure holiday for haemophiliac boys. And you say in your statement that you'd had a bit of a fear of the nurse being the one to do it, and you found it easier to find your veins than the nurse.
Yes, it was the first time I had injected myself when we were in Wales at this activity holiday, because all the children that were coming out crying, and it was making me feel worse. And I thought, I spoke to Myles and I says, kind of, what will I do? And the only other option was to try and do it myself. So I done it myself with the fear of them making me cry. But at the time, I actually got a bleed when we were out on an activity, and I didn't have enough treatment, and my ankle was really swollen. I struggled to get my boot on at the time, but Dr. Ludlam had told us, under no circumstances, to take English factor, to come back with a bleed if you had one. So that's what happened. That was the end of the holiday for me. That was just sitting while everybody else went out, because I refused the English factor when I was there.
And do either of you remember what year that holiday was?
Can't remember.
Was that, what age you think? You were about 14?
I must have been.
13, 14, so that. It must have been around 86, 87.
Paul, you also recall Professor Ludlam referring to you and Myles as pups, but also as his boys.
Yeah.
You've recalled in your statement you and Myles were very anxious when news of HIV, AIDS and its connection with haemophiliac patients broke. You were always worrying that you had HIV because of everything you were reading in the press.
That's right.
And you remember difficulties at school as well.
Yeah, we were treated so differently. People would come up to us, and the teachers made it knowledge that we had haemophilia, and other children would come up to me and ask, if I cut you, will you bleed to death? And they'd actually try and do it in the science class with a scalpel or whatever. Called AIDS scum, junkies, gay boys, everything like that. There was even stuff written in where we stayed in Edinburgh. There was stuff written down on the ground. AIDS scum to my brother, his nickname, Mitch at the time, and to myself. And people, I ended up walking about at school sort of yourself. I was a loner because I couldn't actually make specific friends because people were strange towards us.
You too, Paul, remember in your teens feeling tired, having to lie down when you got home from school, having what you thought at the time were a lot of colds or flu-like symptoms, aches and pains, brain fog, not being as energetic as other kids.
Yeah, every day after I came in for school, I'd just put my bag down and go and lie on the settee, and that would be me for about an hour, 2 hours, and then I'd get up feeling a bit better. But that was always the case, and I never thought like it was for anything else. I thought, just coming for school, you're tired. But obviously, for other reasons, now knowing, that's why. And I'm still like that. I still have to have a nap in the afternoon, and I feel guilty for doing it. And it's just, I don't know why, but I do. I should be doing stuff. I should be working, whatever. But I still do that. And
you, Paul, share Myles's concern that you've been the subject of tests or studies without your knowledge and consent.
Yes.
And we'll look at a small number of documents. Henry, these are 2167 documents. So 2167014, please. This is a letter dated the 7th of May 1980. It's from Dr. Ludlam to a consultant paediatrician at the Leith Hospital. That was the hospital where you received your care prior to your care being transferred to the Royal Infirmary.
Yes.
And we can see here, it says, Dear Dr. Syme, I believe that until recently these two brothers with haemophilia were under your care. Each year, as you will know, we have to compile statistics for the amount of treatment used in patients with congenital bleeding disorders. These then form part of the national statistics that are meticulously collected by the Oxford Haemophilia Centre on behalf of the Haemophilia Centre directors. I am currently collecting the treatment records for 1979, and I should be most grateful if you could let me know the total number of packs of cryo and units of factor, actually says 8, but you would have been receiving factor 9 concentrate given to both these patients. I am sorry to trouble you with this small matter. Now, as I understand it, you don't have necessarily an objection to statistical information being collected, but you don't think that your parents knew that this information was being collected.
My parents had no knowledge that at all, neither did I, yeah.
And you have a concern that this was Dr. Ludlam not simply providing information about his own treatment, but looking to see what kind of treatment you'd been receiving previously.
Yes.
Could we have 2167020, please? The date of this document's unclear, but it's from your records, Paul, and it's got on the right-hand side the word AIDS, and then it's unclear whether what's written there is skin or whether it's part of the word study, or whether it's something else. But do you know why there should be any reference to AIDS, whether it's study or another word, in your medical records?
None at all, because I didn't have HIV, AIDS.
21672021, please. Now, this is a very difficult document to read, and all we can decipher from it is that it's from Dr. Ludlam, and it's addressed to Dr. McClelland, who was a director of the blood transfusion or the blood service, and it appears to be about you, and that's about all that can be read. Do you have any knowledge as to why that would be in your medical records, or why there might be correspondence about you?
No knowledge whatsoever why Professor Ludlam would be in contact with Dr. McClelland, no.
And then 21672022, please.
Just before you
Sorry.
leave that, does it help to put yellow over it? This is reference to hepatitis.
Yes, there is a reference to hepatitis in the second line. We've not been able, even with yellow highlighting, to clearly work out what's being said. And this is the copy as provided to Paul or his legal representatives.
Yes.
But other than hepatitis, it looks like it might be hepatitis B. But
It looks like the latest something of hepatitis B infection. Thank you.
It does look like hepatitis.
Mm-hmm.
and then you have
Thank you.
yes, something let you know in the first line.
That the above gentleman, with something or other, is the latest something of hepatitis B infection. Latest victim? I don't know. It's not victim, but it's something. And then
That's hepatitis B infection.
I have just something identified that the development
That he developed.
Thank you. So that's dated 1984.
Yeah, it looks like it, but again, yes, on the screen, it looked June 1984, 20th something of June 1984.
So there looks to be a reference to this gentleman having, it looks like possibly contracted hepatitis B 1984.
Although it was Myles who'd contracted hepatitis B in 1984, you hadn't, Paul.
No,
That's correct, yeah.
unless I hadn't told me.
21672022 then. This is a letter, June 1992. It's addressed to Dr. Ludlam. It's from Professor Gianelli, Professor of Molecular Genetics at the United Medical and Dental Schools of Guy's and Thomas's Hospital in London. It refers to a mutation in you and sets out what that is. Do you have any idea what that relates to?
No idea.
Were you ever told at the time that there was some form of dialogue or discussion about this?
Never.
You also recall the device that Myles has described with the multiple needles.
Yes.
Did you know what that was for?
No, I didn't have any idea. We went up together for that, and all I can remember was it was really painful when they done it. Didn't know what it was for. And we always put our trust in Professor Ludlam, and what he says was for the benefit of us. So we done the things. So I didn't have any idea what it was for, though.
And you've learnt from your medical records that you were tested on a number of occasions for hepatitis B from the mid-1980s onwards. Were you told that at the time?
No.
Henry, could we have 21670006, please? This is just an example from your records. It's one of a number of examples, but we see the biohazard sticker or the risk of infection or the stamp or sticker on there. And that's a feature of your records,
Yes.
stamped risk of infection. If we have then 2167007, please. This is a letter from a consultant surgeon to a clinical assistant to Dr. Ludlam. It's dated April 1993. It's asking about a procedure that the details of which are not relevant for present purposes. But it says this in the last paragraph. Incidentally, I would be grateful if you would let me know whether or not Mr. Hutchison is still to be regarded as a high-risk patient from the point of view of taking special precautions in theatre, and subsequently, it's important that we know this so that his case may be appropriately scheduled on one of our lists. Just pausing there, you weren't, I think, aware at the time that you were regarded as a high-risk patient.
The only thing that I knew was I was to be taken first thing in the morning to get the procedure done. Then it got changed all of a sudden that I was last into the theatre to get it done. So looking back now, I could only imagine it's because they thought it was a high risk and they didn't want to put anybody else at risk.
And then we can see in the bottom right-hand corner, handwritten entry. We could have the bottom of the page, please, Henry. And if you could highlight those handwritten words on the right-hand side. And it says, Paul was tested negative some years ago. His, and then a word is crossed out, which looks to me as though it might be sexual, but it's not clear, it's crossed out. Behaviour since would not lead me to believe he is now anything other than normal Edinburgh risk. The word risk has been cut off on this, but the original says normal Edinburgh risk. Do you have any idea what the phrase normal Edinburgh risk refers to?
No, his first knowledge of that was seeing my medical records there, but I didn't have a clue what it was about.
Myles, I want to turn back to you and ask you how you learnt you've been infected with hepatitis C. You now know you have hepatitis C genotype 3 from factor 9 products that were administered to you.
That's correct, yes.
It appears from your records that you and your parents were told of that diagnosis around the autumn of 1993. Is that what you remember?
Yeah, it was around about that time, that's correct. I received a phone call from the hospital and asked me to come up because they needed to speak to me about something. And I went up the next day and I sat down and they told me, I'm sorry to tell you, Myles, but you've been infected with hepatitis, but I wouldn't worry too much. It's not that big a deal. You might get flu-like symptoms, things like that, feel a bit tired, which was a wee bit funny to me because I'd been feeling that since I was about 12 years old. And but they didn't make a big fuss of it. I says, is that not meant to be quite dangerous because I've had hepatitis B and that's a killer, you know, it has killed people. And they said, oh, no, it's nothing to worry about. You don't need to do anything special or anything like that, but it's just that we feel obliged that we should tell you about it.
We'll look at a couple of documents. Henry, could we have 2168004? So we're on to 2168 now, please. Thank you. And we can see the date of this is 23rd of September 1993, at the top date of admission, date of discharge 24th of September 1993. It's a discharge summary. And if we go down towards the bottom of the page, please. We can see in the paragraph headed management, 5 lines down, it talks about you being very reluctant to stay in hospital, and it says this: partly this was because discussion regarding his hepatitis C status had been instituted with him. His wife was a little upset to discover that he was in fact hepatitis C positive, and he was anxious to be at home with her to reassure her. And that helps us try and date when you were told, sometime in September 1993, you think?
That's correct.
And if we have up on screen 2168005, we can see here then a letter the following month, 26th of October 1993, from one of Dr. Ludlam's clinical assistants to your GP. And it says in the second paragraph, I'm very sorry to hear that Mr. and Mrs. Hutchison have been so worried about hepatitis C. And it refers to both of you, in fact, having appointments to be seen by Dr. Hayes in November, who'll be able to answer questions, and encloses a copy of an information leaflet we've made up for patients, which you may find of some help. So that was being sent to your GP.
Yes.
prior to being told that you were hepatitis C positive in the autumn of 1993, had you been made aware that you were being tested for hepatitis C?
No, not at all.
Now, if we could have up on screen, please, Henry, 21688016. And could you highlight the bottom half of the page, please? What we can see from this, Myles, if we look at the date's July of 1992. It's actually clearer on the hard copy than on the screen. Date received, this is the sample 6th of July 92, date reported 10th of July 92. And we see it says final report, enzyme immunoassay for antibody to hepatitis C virus positive, confirmatory assay for antibody to hepatitis C virus positive. So these positive test results for July of 1992 appear in your records, but you don't think you were told of your diagnosis until over a year later in September of 1993.
That's correct. They mustn't have felt obliged at that time to tell me.
Can you recall what, if any, information you were given about the prognosis for hepatitis C infection?
I was told that I might get some flu-like symptoms, be a bit more tired than usual, but it wasn't such a big deal. But I was warned that I shouldn't tell people about my infection. They even said maybe it'd be an idea not to tell your wife. But the information was minimal. It was sort of palmed off, and the main thing that I took from it was I should keep it to myself, and it won't be as bad for me.
And we'll look at some of the correspondence that followed. Could we have 21688018, please, Henry? This is now December of 1993. It's from the clinical assistant to Dr. Ludlam, again to your GP. And it says, I'm writing to let you know that Myles was seen by me in the Haemophilia and Hemostasis Centre today with his wife. The consultation was mainly regarding his concerns about hepatitis C, which have been discussed, as you are aware, with Dr. Ludlam and Dr. Hayes in the recent past. And I understand that you've also discussed this at some length with him. I did my best to be informative and generally reassuring relating to hepatitis C, its consequences and treatment. First of all, can you recall having a discussion at some length with your GP?
I went to my GP because I was scared, because I'd received so little information. And as I knew that it was a blood-borne virus, I was worried that I could hurt my wife or anyone around me, because I like to think I'm a decent person and I wouldn't intentionally hurt anyone. So I went to my GP to get advice from him, and his advice was actually don't trust Dr. Ludlam. And
do you recall anything about this appointment in December 1993? The doctor says that they hoped to do their best to be informative and generally reassuring. Do you recall whether you were reassured or had the information you thought you required?
Not at all, no. Once again, like my mum and dad before me, I was fobbed off. I was told I was worrying about nothing. The main thing was to keep it to myself, and any questions that I had, there's a wee leaflet. Read that tonight. You know, same as they done to my dad years earlier with the hepatitis B. They gave him a leaflet, and unlike unfortunately, I didn't listen to his advice. Wonder why? And I spoke to my wife, and that was the start of a lot of other problems.
And we'll come on to the family life later. But if we could have 21688019, please, Henry. This is a letter of the 21st of November 1994, so this is later on in the following year. And we can see, if we go down to the large paragraph, please, Henry. Picking it up about 6 lines down, it says, earlier this year, investigations were carried out to assess the degree of liver damage secondary to hepatitis C. An endoscopy was performed in February, which was normal. And then it refers to a liver biopsy being carried out in February, which showed mild chronic hepatitis, but no evidence of cirrhosis. The features were consistent with chronic infection of hepatitis C. Liver function tests have been abnormal for some time, and most recent ALT is 413 units per litre. We're currently treating many of our patients who have hepatitis C with interferon. Myles will probably start treatment with interferon sometime in the next few months. Now, there are two things I wanted to ask you about relating to this letter, Myles. The first is the reference to liver function tests having been abnormal for some time. Had you been told that your liver function tests had been abnormal for some time?
On one occasion, I remember being told that some of my blood tests had came back and I were a bit concerned about them. But they never went into any great detail. They just said, so we're going to take some more bloods now, and run tests again. But they didn't mention my liver function specifically, no. I was just told that some of my readings were abnormal, which it says there, but they didn't specifically state it was my liver. They just told me they wanted to redo the tests.
And then we can see the reference to a liver biopsy carried out in February of 1994. What can you recall about the biopsy and how you ended up having it?
The biopsy, that was the biggest mistake of my life, to be honest. I was talking to Professor Ludlam and he said, Myles, it would be a lot easier for us to judge how bad, your liver's been affected by hepatitis if we took a small biopsy. And he said, it's not a bad procedure. It'll just be a short thing. We'll get a wee piece of tissue and then we'll get back to you with results and stuff. And I said, if I got this done, would you have to do it with my brother? And he said, not really, no, because your brother and you're virtually identical. It's the same sort of results would be had. So I went in a couple of weeks later, and while I was getting a liver biopsy, I woke up, and I seen my own internal organs on a screen next to me, and I shouted to the chap that was doing it, I'm awake, and that's blooming so. And he was prodding about, trying obviously get into the liver tissue to take the sample, and it wasn't the same chap that started doing the procedure. It was a different chap, and maybe it was anaesthetist, maybe I'm confused, but it looked to me as if the anaesthetist had already done his job and the guy that was doing it came in. And then I just remember getting that white stuff banged into me till I passed out again. But when I went back to my doctor after it and I was talking about getting more pain in my stomach, he said, you shouldn't have had a liver biopsy if you've got hepatitis. It's going to really damage your liver. Your cirrhosis is it might have been mild at the start, but after the biopsy, my cirrhosis went through the roof. So it was basically Professor Ludlam's advice destroyed my liver.
We've got a letter from your mum from around this time. It's at 2168020. And it's dated the 1st of November 1994. It's from your mother to Dr. Ludlam.
Yes.
And it says this, and I know this is an important letter to you and you want it for your mum's sake, us to go through it.
Yes, I do, please, yes.
Dear Dr. Ludlam, since Myles and Paul were born, I've naturally worried about them. I could write a book with experiences, both good and bad, that I've had over the years. When they were children, I thought that bleeds were my main worry. As you know, some bleeds are very painful and caused my boys great distress. Unlike today, mothers were not allowed to stay at the ward overnight with their children, and every night I had to leave them was torture. I thought as they got older and a little wiser, things would ease, that they perhaps wouldn't get so many bleeds. Then along came AIDS and the terrible fear that they would be infected. Unlike a lot of unfortunate haemophiliacs, they, thank God, were clear. Now we have hepatitis C and are worrying about the long-term effects such as liver disease and cancer. We are told that interferon has a 20 to 25% chance of producing normal liver function tests, but like everything else, it also has side effects. I think that you and your staff do a wonderful job and they're very dedicated people, but sometimes you forget the human factor. John Smith and Harry Bloggs are sons, husbands and fathers, and their emotional well-being is as important as their physical health. My sons are trying to live normal lives, but are finding it very difficult. I want them to do anything that will be helpful to them and increase their chances of a long and fruitful life. But I'm afraid to advise them in case the treatment causes other illness and makes their life even more difficult. I feel that hepatitis C, the illness and the side effects that stem from treatment with interferon have not been fully explained to them, and that if they could see a little light at the end of the tunnel, they could look forward to a future which they are convinced they don't have. I know that you can't make any guarantee about their future health, but a little reassurance would go a long way. They are only starting their lives, and I want them to be happy, and it's breaking my heart to see them hurting so much. The pain they are suffering emotionally just now is far worse than any bleed they have ever had. I love my sons, they are my life. Could you please talk to them? One of the reasons it's important to you to have that letter read out is because of the role your mum has played in both your lives.
Yes.
And one of you, I think, says in your statement that she has blamed herself because she was the one administering the injections.
All her life she's blamed herself. Out the blue she'll phone us if she hears anything on the telly and she'll start crying, saying she's sorry. For the first injection she gave us, she's blamed herself for giving Myles and I what's wrong with us. So much so her has been terrible. And it's broke my mum and everything that went on. And my dad, of course.
My mum was trying to protect her children. She just wanted answers. She just wanted to try and give us the same future that any reasonable parent would want for their children. And she was denied basic knowledge or choices, and she put so much faith in people and they let her down so badly. And even though she didn't personally, well, she did, she injected it, and that's the problem. She did inject us with it, but she had no knowledge at all that she was hurting us. She thought, she used to practice on her own arms with needles before she started giving us it. She'd have blood running down her arms because she didn't want to hurt us. She'd practice on her own veins. And she'd do anything for her boys, and you can't take away from her. She did give us it, but only because she didn't have the knowledge to make an informed choice.
She thought it was going to help us.
She was just looking after her kids, that's all she was doing. But she'll never see it like that, and we know that.
We can see from the letter that in November of 1994, she felt that she and you had not been given sufficient information about hepatitis C and the pros and cons of treatment. We can see, if we have up on screen, please, 2168006. Dr. Ludlam did meet with your parents after he received the letter. It's dated the 18th of November 94. It's addressed to the Social Work Department of the Royal Infirmary, and it refers in the opening paragraph to having received a letter from your mum expressing some anxieties about hepatitis and its treatment. And Dr. Ludlam says this: I met with Mr. and Mrs. Hutchison this morning. We had a fairly full discussion. I explained to them about hepatitis C and its potential treatment with interferon. They both seemed more reassured after our talk. I gave them a copy of the Haemophilia Society booklet on hepatitis and also the local information leaflet we devised. If we just leave this up on screen for a moment, please, Henry. We can see there Dr. Ludlam describing it as a fairly full discussion, providing an explanation and reassurance. Do you know what your parents' recollection or experience of that meeting was?
Nothing like that. They were in a room with Professor Ludlam, who was very agitated that he was having to do it. And he says, have you any questions? And he was very vague with my mum and dad. And he said, look, you're worrying over much, over nothing. They'll be fine. And, here's a leaflet. Look through that. I'm very busy. I've got to do things. And that was it. It wasn't reassuring. He was not a reassuring man. He's not the type of man that gives reassurance to anyone. But all my mum and dad wanted, like any parent, was some information, some knowledge, and how they could help us. But all he did was palm them off yet again. He gave them a leaflet, and when my dad came home, I said, how'd you go on, Dad? And he went, another leaflet.
I mean, there was no point. It involved social work as well, with Geraldine Brown, and she never even got in contact with my mum and dad.
And then we see in the paragraph below, it says this: we also went on to discuss the rather more general issues that are causing the family concern. As you know, both Paul and Myles are off work because of, and then in quotation marks, depression, and you were seeing them both individual. Probably should be individually. You expressed the concern in your statement, Myles, that this observation about depression is regarding the depression as something separate from, unrelated to the diagnosis of hepatitis C,
Yeah.
whereas you both view, as I understand it, your depression that you were experiencing is intimately connected with the diagnosis of hepatitis C.
Definitely. I mean, we were both happy kids. You know, we're a good mum and dad. We had every reason to be happy. We had people that cared for us. We had a loving family. Yes, you've got problems. Anyone can get depression. I understand that. But it wasn't, you know, until our teens at the Royal Infirmary that we started to not be as happy as normal kids anymore. And I'm convinced that the hepatitis, me also the Hep B, the things in my body that were hurting me did cause depression. The physical pain caused mental pain as well. And the same with my brother. It was a pain no one could see, so you couldn't put a name to it, but we felt it, and it affected our minds. But there was no thought attached to it whatsoever that the problems that we'd had and infections we contracted could cause depression. I don't know, I think they must think all haemophiliacs are supermen or something that can just shrug aside their feelings, but when you're feeling as low as you felt with that, and then you get treated with things like interferon, depression's very easy.
Before we talk about interferon, Paul, I wanted to ask you about how you were informed that you had hepatitis C. You were working at this time as a clinical biochemistry assistant in the Royal Infirmary.
That's right,
You were about 19 or 20. And you've got a recollection of being told by Professor Ludlam that you had tested positive for hepatitis C.
Yes, after I found out about my brother, obviously I went up to see my brother, and I was devastated for Myles when he'd been told that he had got Hep C, and tears, wishing it was me that had got it, because at this stage I didn't know I had it, and then I got a phone call to go up a couple of days later to see Professor Ludlam. He sat me down and he says, I have to inform you, you've also got hepatitis C. We don't know much about it, he says, but there's a possibility you'll die of liver cancer. And he said, have you got any questions? At this stage, it was just, I just stared at him. I was in shock anyway. And that was, he said, we'll provide leaflets when we get more information. And that was it. And then I left in a daze, and I went down to the ward where Myles was, and we cried. When I told Myles I had it as well, he was the same. He wished it was just been himself that had got it.
And you said in your statement that Professor Ludlam said something to the effect that they knew you'd had non-A, non-B hepatitis.
Yes, that's right.
For some time.
Yeah.
But you weren't aware of that.
I wasn't aware of this, no.
You were told by Professor Ludlam, I understand, not to tell the people you were working with at the Royal Infirmary.
Yeah, he says, under no circumstances tell anybody you work with in the clinical biochemistry labs that you've got hepatitis C.
And you were also told by Dr. Ludlam, Professor Ludlam, either at that meeting or subsequently, about the possibility of passing hepatitis C through sex, saliva or blood. Is that
Yes,
right?
that's right.
And you say in your statement, to this day, this still worries you.
Yeah, it does. I mean, even though I'm supposedly clear, the Hep C virus, what they say is dormant, it's at such a low level, I still believe it's in my system. I still think it's there. What was
No, well, it was about the information that was given about the fear of transmission, and that's still worrying you.
Yeah, I mean, I still to this day, if I cut myself in the house, I got blood in the handle of the door. My wee lass says, blood in the door, and I jumped up to and run through. Did I touch it? Even to this day, even though I'm supposedly not going to infect any of my family members, it worries me sick that there's a possibility that I could give my kids or my wife Hep C.
We're again just going to look at a few of the records relating to your hepatitis C diagnosis, Paul. Henry, could we have 2167008, please? And we can see this is dated top right-hand corner, January of 1993. And if we go further down page, we see the January 93 date there. First report, enzyme immunoassay for antibody to hepatitis C virus positive, results of confirmatory testing to follow. So there appears to be a positive result, at least a preliminary positive result, in January of 1993 that you weren't told until September of 1993. Is that right?
That's right, uh-huh.
And if we have up on screen 2167009, this is a letter 24th of September 1993 to your GP from a clinical assistant to Dr. Ludlam, and it refers to you attending the Haemophilia Centre today where we discussed hepatitis C. It refers to hepatitis C antibodies and that you have slightly abnormal liver function tests. And it says this: hepatitis C was discussed at some length with Paul and he was given an information sheet to take away with him. If we then have up on screen, please, 2167010, we can see a letter dated October of 1993. And again, it just gives us some insight into how your parents were feeling. It's from the GP. It says, I've had a meeting with the parents of my patients, Paul and Myles Hutchison. They are worried and perplexed by this new terror of hepatitis C. Paul specifically is increasingly rejectionist of all advice as he has been witness to all the story of HIV and hepatitis B. And that was, as I understand it, Paul, from your statement, the beginning of something which continues to this day, where you are very concerned about putting any trust in doctors and taking any form of treatment.
Yeah, I don't trust them whatsoever. I think everything it tells me, it's all lies they're telling, I feel.
Can we have up on screen, please, Henry 2167011? This is 16th of December 1993. It refers to you having been seen in a joint liver haemophilia clinic and says this: as you know, we discussed with him whether further investigation should be undertaken. While he's antibody positive, he is PCR negative and his liver function tests at the moment are only mildly abnormal. However, on reviewing his case history, his transaminases in the mid and late 80s were persistently over 100. I therefore think that we cannot be absolutely sure that he has entirely quiescent disease or what stage it is at. Do you recall whether you were told about the persistent results over 100 in the mid-late 80s?
I was never told this.
And we can see from this in December 93, it records you as being PCR negative. I'm going to ask you both now about the treatment you received from your hepatitis C. Myles, you first. You had interferon in 1995. You were in your early to mid-20s. What can you recall about that experience and any side effects that you suffered?
It wasn't the best, to say the least. I went to the hospital and they said, we're going to give you this to take injections of. You might feel, the usual flu symptoms, but you should be fine about going to your work and things like that. And I started taking the injections, but I couldn't keep doing it for, I think I was only on it for about 6 weeks maybe. Because my behaviour was changing. I was irrational, I was becoming moody, becoming more aggressive as a person, which really isn't my nature. I'm not aggressive by nature. And I started to feel terrible, shaky. It was like the worst hangover mixed with the worst cold you've ever had. My joints were sore, it was just horrendous. So I had to stop. I said, I'm sorry, I can't do this. And I went up to the hospital, took the treatment back. And but after it was the feelings were still there. It's, even though I stopped taking it, it seemed to go on and on and on. And I actually felt like it made things worse. I actually felt 10 times worse after it. And even 6 months after it, I still didn't feel as well as I did before I started taking it.
And you've said in your statement it's around this time that your mental health started to go downhill. And there were 2 occasions when you tried to kill yourself.
That's correct, yes.
Can you tell us about that, to the extent that you would like to?
Well, I stopped being the person that a lot of people knew. As I said, my moods changed. I became aggressive. I drank too much. I became a more selfish person. I had a wife that I was not the understanding type, let's say. She expected life to be a smooth, easy ride, but it wasn't possible with everything that was going on with me. And my head just went down. I went to a dark, dark place where I hope I never find myself again. The first time I got in my car and I drove into another car with a seatbelt on, hoping that I'd go through the windscreen and it would end me. I don't know how I survived that, but I did. And then my marriage split up. I lost my house, my job, everything. And I was back with Mum and Dad, and I couldn't cope. I'd lost everything. My pride was gone. So I went down to Granton Harbour in Edinburgh, and I jumped off the pier. And instead of dying, I tore the muscle in my leg on the rocks at the bottom. And luckily, someone seen me there, and the police came and got me, and they took me home. I don't know why they took me, my mum and dad's, who automatically phoned the hospital, and I got taken up there. And it's pretty hard to explain how you got a bleed when you jumped off a pier. It's obvious you weren't just trying to go swimming, because the tide was out. So yeah, that's a couple of times. Other times I thought about taking pills and doing other things, injecting air into my veins to try and cause a hemorrhage. I've thought of lots of ways to kill myself, and it's not a normal thing for any human being to have to think. And I'm just glad it never happened, but it never worked, sorry. But yeah, I've been to the darkest place. I hope I'll never go back.
And you said in your statement you were scared of what was inside you.
Yeah.
And what did you mean by that? The hepatitis, or psychologically what was inside you, or both? I
was scared of both. I don't know, my brother sometimes says this, it's sometimes in my body when I wake up I feel like I've got fire ants going through my skin, under my veins. I just feel so sore and so tired, and my body, I feel like, I know I'm a big chap, but it's like you're trying to move turn me, I'm not quite there yet, but I feel it's just such an effort to move. And mentally, it just drags. I've just been that badly damaged. Sorry, I've lost myself there.
No, you've answered it perfectly, thank you. In 2003, you were advised by Professor Hayes to attempt treatment again because the risk to your liver.
That's correct, yes.
And so on this second occasion, you had interferon and ribavirin for 6 months.
Yes.
You've described that in very vivid terms in your statement as hell on earth. You thought you were going off your head. You were in a dark place. What can you tell us about it?
What I can tell you is the dark place that I was hoping to never be in again very nearly came back. Luckily, the second time I was on Interferon, I had my current wife, who's a lovely person, very supportive, to help me through it. And I also had my wee kid, my wee daughter there, and I had something to, fight for. I wanted to get through this. But I was warned a few times that it was getting dangerous when I was taking it. My results were coming back, and I was getting very ill. It was really hurting me. They were told me half the amounts I was taking, but I was determined to get rid of this horrible thing inside me, so I kept taking the full amount. And for 6 months, I basically just clung onto one side of the wall to get through it, because the place that I'd been before in my mind, the dark place, I seen the wee bright light with my wee kid's face, and I kept walking towards that instead of there again. I felt that as the nearest I've came since, but I tried to hurt myself to being here again. It's a horrible, horrible treatment. If it wasn't for what you think it's going to do, nobody in their right mind would take it. But as I'm sure a lot of people here will know, you're that desperate to get some good back in your life, to get something out of you, to feel a wee bit better, that you've got a chance at being happy again and no feel so ill. You'll do almost anything. And I did it, I went through it, and they told me it was cleared, which I then found out's, a matter for great conjecture, because it's not clear, it's still in my body, it's lying there dormant, and I've got this constant fear that I'll start again. because I want to be here now. I've got something to live for. I've got my wee kids. I've got my lovely wife, you know, my brother, my family. I've got a lot to live for, but I'm genuinely scared about how long I've got.
And you said in your statement, although that course of treatment was, you were told, successful, and the description that was given to you was that the hepatitis C was now dormant, you still suffer many of the effects of being infected, and you say it doesn't seem that I'm clear of anything.
No. All the same pains, all the same things that I hoped would disappear when I done this treatment, that's why I did it. I hoped that, you know, I'll feel a bit better, be able to play with my kids more, do more. Just didn't seem like anything changed. If anything, my mental health had been damaged again a bit. You know, that the only thing that I got was I seen a wee glimpse into the dark place I'd been before, and it reminded me I have to watch what I'm doing. That's all that I got for it, but I certainly didn't feel any better.
And you put it this way in your statement, Myles, you talk about having gone through the 2 courses of treatment and the detriment to your physical and mental health. You say that the spark in you has gone.
Yeah.
You feel a different person.
Yeah, it's just like, you know, anyone, when you're growing up, you're young, you've got ambitions, you see life, you see this big opportunity to be someday, you know, make a difference to other people's life, you know, be someday. No, you don't have to be famous or rich, or just be somebody that people want to remember. Somebody that's, they go, yep, nice person, you know. And I tried my hardest. I was a boy that would help a wee lady come off the bus and you were messages to her house, and my mates would all make fun of me and things like that. But I wanted to be that guy. And I just feel that the spark that we've all got when we're born inside us, and it grows depending on how we live our lives, it just got totally wiped out. And now I'm lucky that I've got some lovely wee sparks around me that I call my family, and I try and feed off of their dreams and hopes and that, and try to help them out now, because I feel my hopes and dreams are gone.
Paul, you had treatment for interferon in 1995.
That's right.
Your medical records record that you were hesitant about it, and you managed to stay on it for 4 months rather than the full 6 months.
That's right, but the side of I was working in the Royal Infirmary at the time as a clinical biochemist, and Professor Liddell would say to me, "You'll be able to continue working whilst on interferon," because I'd only been in a job for just about a year, and I was wary, obviously, about starting a new treatment because I didn't. With side effects, you didn't know what would happen. I started it, and the side effects were horrendous. I was getting bleeds in my abdomen where I was putting the actual interferon, so I was getting bleeds as well as taking interferon. It was a lot worse than the flu. I'd been in the house shaking my body. I couldn't even walk to shops for a paper because my vision was blurry, and it was horrendous. So much so, I gave up. I took it. I went for the 4 months, but I was that sore and tired, and I was just similar to my brother. I was sort of in a really dark place, and I didn't want to be here anymore. I couldn't take it anymore. I'd had enough, and my mum and dad, they wouldn't leave me in the house in case I tried to commit suicide or whatever, because that's how I felt. I didn't want to live anymore.
You had mood swings, depression. Physically, you had problems with hearing, vision, sore head, coordination problems.
Yeah.
Could we have up on screen, please, Henry, 2167012? We can see this is a letter from October of 1995. And it says this: "I was pleased to see Paul at the Haemophilia Centre this morning. As you know, he stopped interferon on the 13th of September because he was finding the side effects intolerable. However, shortly after he stopped, we had the results of his HCV RNA quantified by PCR, which showed that he'd become negative in May, just before he commenced interferon, and was also negative in the most recent sample, which was at the end of August. I explained to Paul that even when his PCR was positive, the level of viremia was fairly low, and as it had become undetectable, this was a very good sign. However, we will have to monitor him closely, as it is, of course, possible for his PCR to become positive again." So we've seen from earlier correspondence you were PCR negative December 93. We see from this that they discovered after you'd stopped the treatment you'd been PCR negative before you started.
That's right.
We also see you being told here that although undetectable, it could become positive again.
That's right.
And that's the fear that's haunted you ever since.
Yeah, I mean, when I had the interferon, I lost my job. I thought I'd get a lot more support working in the Royal Infirmary through it, but I ended up losing my job because of being off depression. That just made me even worse, losing my job. Made me feel worthless. It was what was the, sorry, lost my train of thought there.
No, the fear that you've had ever since, that the hepatitis C is still with you.
Yeah, I mean, it doesn't matter. I've seen Professor Hayes, and they've told me that it's fine, you've got nothing to worry about. It doesn't matter what he says. I don't believe him at all. I don't trust him. I don't trust anybody at the Royal. I've seen the psychologist for over a year and a half at the Royal Infirmary, and I eventually says to her, I think she's binge watched see me again. I said, I think we should just call it a day now. I says, you can't fix me. I said, I'm broken. I says, it's in here. It's in my DNA, and nothing that anybody can say will change the fact that I still think I'm going to die of liver cancer. In my mind, it will still happen sometime, or that I could infect my family or something.
And we can see from some of the correspondence in your medical records that you have returned to the doctors over the years, and your concerns remain. We'll have 2167-002, please. And if you could highlight the first paragraph, please. This is November of 1996. And so this is a year on from the interferon treatment. It records you attending the haemophilia centre with your mum. You and your mum had a number of questions relating to hepatitis C. You wanted to know if you should have a laparoscopy and possible liver biopsy. Dr. Hayes explained that previously he'd had slightly abnormal liver function tests, but following his short course of interferon treatment, which he took between June and September 95, his liver function tests had been normal until September 1996, when his ALT was only very slightly outside the normal range. And then it refers to it being likely you have a very low level of viremia, as we've only detected hepatitis C RNA by quantitative PCR on one occasion in October 94. It refers to samples between May and December 95 negative. And then it says this: it's difficult to know whether this means that he's cleared the virus or whether it is at too low a level to detect by our current methods. And that's your fear. You just don't know whether it's still there or not in your mind.
You basically said that it's at a lower level, that it's undetectable. There's a certain test you can do to say that it can detect it, whatever. But it's still in my body as far as I'm concerned. And after you said that, that stuck with me, that something could then make it happen again for it to become active. And that's a really big fear of mine. That I'll leave my wife and kids.
And we can see if we have 2167-003, please, Henry. This is from March 2000, so it's some 5 years further on. If we go to the bottom of the page, it says, while he was here, we had a long discussion about hepatitis C. Paul has taken away some information leaflets regarding hepatitis C. You must have a lot of leaflets, Paul, by now. I again explained to him that our last test showed that although he has antibodies against hepatitis C, the quantitative PCR test has consistently been negative for some years. I explained that there was a lower limit of viral detection in these tests, and therefore if there was any virus present, it was at a very low level. We are unable to say that there is no virus present in the liver without performing PCR tests on a liver biopsy. And then it says that you don't need treatment because the aim of treatment is to make PCR tests negative. So again, you still don't have the confident reassurance that it's definitely been eradicated?
No, I mean, I've still got the feelings that I'm a lot of pain. I'm tired all the time, and that obviously makes me feel that, well, it's still there, obviously, or I'd feel, hey, I'm coming back to normal.
Myles, I wanted to ask you about being told of potential exposure to vCJD. You were told in 2004 that you were at high risk for public health purposes in terms of vCJD. But more than that, you were told that you've actually received a factor product from a batch that is implicated, a batch including a donation from a donor infected with vCJD.
That's correct. Professor Ludlam told me that unfortunately I'd had over 40 treatments, which could be anything from 4,000 to 5,000 units factor concentrate from the factor derived from a man who had died directly, the news directly from him of variant CJD. So I obviously was very upset, and I said, well, can you not test me for it? You know, is there a treatment? Because we've seen all the fuss with mad cow's disease. It was crazy. I thought, no, another thing. This is getting beyond a joke. And he says, is there a test you can do? He says, unfortunately, the test is not very reliable and it's very expensive. So we're not doing it as such. He says, but there's no point in us doing the test because there's no known treatment for it anyway. I said, so where does that leave me? And he says, well, I'm sorry, it leaves you the way you were when you came in, only you know now that you might have vCJD.
And that's impacted upon the way in which you receive care. You're labelled as, again, as high risk of infection in medical notes, you say. And there was one occasion when you were due to have an endoscopy and that didn't go ahead.
Yeah, I was due to get several things. I've actually been told by surgeons they wanted to do surgery on kidney stones, gallstones, things like that. And they phoned the Royal to check for my clotting levels because it was usually the Western that I'd ended up, and they just treated me like anyone else until my files came through with the biohazard thing, and then I had to make a phone call. And they said that after speaking to the Royal, they weren't going to go forward with the surgery anymore. They were just going to monitor it because it was too much a high risk. And I said, well, high risk to myself? They went, no, high risk to others. And I went, oh, okay, so I'm being denied treatment because of a yellow badge on my file. And they said, unfortunately, yes. And I've heard stories about insurers not being willing to cover hospitals for the cost of a bed because it's very expensive. But they're obviously worried about these viruses because these beds, you know, you can surely be cleaned down. Surely you don't have to replace a whole bed because somebody's been on top of it, you know. But I've been denied, sorry, I went off on a tangent a wee bit, I've been denied procedures, definitely. But the endoscopy, I refuse to get anything like that done now because I've been told that the camera they use is devoted just to me. But it's 15, 16 years old and it can't take a clear picture. So it's pointless, basically, because they won't use a normal endoscopy for NHS on me. And my mug's got a big yellow badge around it, so I know which one's mine. It's hanging up there, and it's the same one I had a procedure when I was about 30, I think. And it can't take pictures clearly because of the new equipment, but they still insist on using it. So there's no point in me getting the procedure, because I just go through all the discomfort and they can't get a proper reading. So.
And you put it this way in your statement, Myles. This is your perspective on what the vCJD assessment means in practical terms for you. You say this: I feel that I get the brush off from doctors as a result. There have been so many times that surgeries have been mentioned, but they end up not happening. I feel they do not want my blood on the table because of the cost of having to replace that table.
That's correct, yes.
You have experienced ongoing physical and mental health problems ever since
yes.
The events that we've been talking about. In terms of your depression and mental health problems, you remain concerned that they're regarded as something separate from your infection and treatment.
Yes, I definitely do think that they keep them separate until you actually bring them up. For example, I went to my GP a wee while back because I knew I was going to be doing this and things, I thought maybe I should get a wee bit of help dealing with the emotions that are coming out, what I'm going to have to tell people, the things I'm going to have to share. So I went to my GP and I asked him to refer me to someone for psychological counselling. My doctor believes that I suffer from PTSD because of the things I've seen in hospital, the traumas that I went through. Having my arms tied to the bed in the hospital was one of the worst ones, but so I went to a meeting and I says, look, I'm coming here, I'm asking for help, but I want no involvement whatsoever with the Royal Infirmary Edinburgh. This has to be something I know I'm talking to you about, and it's got nothing to do with them. This has to be about me, and I don't want any. They always say it goes back to my haemophilia. It's not about my haemophilia. This is about my mental state, and I want to stay in here. And she says, well, you've definitely got the signs of PTSD, severe PTSD, and emotional trauma problems, and I'm going to refer you to a specialist to give you some counselling. Anyway, I was feeling quite good. You know, I'd got a lot of things off my chest. I thought this is going to help me, and come in here, you know, help me as well. Just get all this away for once and for all. And I came home one day, and there was a letter line from me, and they said, we've managed to get you a referral to the Royal Infirmary of Edinburgh psychology team. We've passed on all your notes and relevant information you provided with us, all the things basically I told them that I didn't want them to know about. They sent all the notes to the Royal, and I'm not going to the Royal, so I'm going to have to go back to my doctor and ask them to try and find an alternative, because they say that it's got nothing to do with mental health, all these things that have happened, but it's funny how as soon as you have a problem, you get sucked right back in under them again.
You say in your statement that for years you hated yourself.
Yes.
You've become, over the years, more socially withdrawn, and you worry about how long you're going to be around for your kids.
Yeah, of course I do. I've become a father. You know, it's a lot different from being an individual that just think about yourself. I've been blessed with my two gorgeous kids. You know, I love them with every element of my being. I had a good teacher in my mum. I think everyone can see how caring she was just with the things she tried to do. And it destroyed her. And I'm trying to learn how to be a good dad, because I think you learn every day a wee bit more how to be a dad. I have recurring nightmares of me lying in my deathbed saying goodbye to my kids. And that's part of the PTSD. I have to cut my nails right down because I scratched my head that bad that I cut myself. And it's the same dream over and over again, just telling my kids I'm sorry, I want to be with them, but I can't. And I wake up panicking, and I'm just so thankful that I'm here. And I check they're in their bed, and you know, it's every single night, and I just think one of these mornings I'll no wake up, and I want to be there for my daughter's wedding, my son's wedding. Sorry, you're not getting married again. My son's wedding. I just want to be their dad. I just want to be a good husband to my wife. You know, but we want to be the person that she fell in love with. And she's even noticed, you know, changes in me with all these memories coming back. But luckily, she's the type of person that loves me enough to see the bad in me as well as the good, and let me get this out me. You know, let me get help for this. Because she says the person that she fell in love with is a darling, a diamond, a gentleman, as she puts it. And that's why I asked for help. But I feel I asked for help and they put me right back to them again. It caused it all.
You still experience similar physical symptoms to those you've experienced for a number of years, joint pains and fatigue in particular?
Yes, that's correct, yeah.
Paul, the picture for you, I think, is very similar.
Yeah.
Your depression's never gone away.
No.
You describe yourself as someone who is largely withdrawn, you don't go out much. You feel tired and very cold a lot of the time. You always have to have the heating on.
Mm-hmm.
You say that sometimes your kids call you Mr. Angry.
Yes.
And you suffer from anxiety.
Yeah.
You've got long-lasting fears about your health.
That's right.
And we can just see that from a couple more documents. Could we have 216717, please? This is 2006, and we just see it at the bottom of the page. It says this: I think it's also important to note that Paul clearly has had long-lasting fears regarding his health. He has been haemophiliac since birth, contracted hepatitis C from the blood products, and this led him to feel angry and distrustful of the health service. He fears that the hepatitis C may become active again, and also he has concerns about CJD. When his wife accuses him of being a hypochondriac, he responds by thinking that he has entirely justifiable health concerns. Well, we've seen the basis for your fears that your hepatitis C may become active again. It says here you have concerns about CJD. If we just have up, please, 2167-015, we can see October 2004, second paragraph of this letter, that you're regarded as falling into the at-risk group of vCJD for public health purposes. It said that if any surgical procedures are considered, advice should be sought from infection control regarding any instruments. And if we have 2167-016, please. If we can see the third paragraph. Again, this is October 2004. He was keen to know if whether he'd received any implicated batches, and he was advised that he had. I explained that we think that the risk of transmission is very low. There have been no known cases of VCG in the haemophilia population as a whole, which is reassuring, as some of the implicated batches were used as long ago as the 1980s. So you are in a similar position to your brother. You've been told you've received implicated batches. You've been told the risk is low, that you yourself will develop VCJD, but you have that fear.
Yeah, I mean, like my brother, I was to go for a colonoscopy. I'd went for one about 15 years ago it was, and just about a year ago I'd went to the Royal Infirmary for another colonoscopy, and they'd put me on the table. Couldn't get a vein, so I had butterflies in my hands and my arms, and the chap that done the procedure, he started to do it, and then realised that the camera wasn't taking pictures, and he spoke to the nurse, and she says, this gentleman's high risk for VCJD. It's the camera that we used on him 15 years ago. We've not to use a new one on him. And he says, why not? She says, it's the expense, because it has to get destroyed.
If we have up on screen, please, 2167-018, we can see how your concerns continue to affect you. Second paragraph, please, Henry. It says this: he explained that he was told he received contaminated blood products when he was 19 years old, resulting in him contracting hepatitis C. He described this as a very distressing time in his life, as he was uncertain if the diagnosis would impact upon his life expectancy. He avoided intimacy and relationships due to worry about infecting others. He described a sense of shame, isolation and stigma attached to the illness, as other people would associate it with promiscuity and drug use. He explained that treatment with interferon cleared the infection, but he believes it's lying dormant and could reappear in the future. He remembers the treatment as very challenging, describing lowered mood, increased fatigue and increased suicidal thoughts at the time. And that's as recently as 2016, you were having that discussion. And then if we have 2167-019, please, Henry. This is 2017. And we'll just look at the second paragraph, please. It says, Paul highlighted specific beliefs and fears about plasma-derived products which acted as a barrier to his prophylaxis adherence. And then it goes on to talk about discussing possible alternative treatment options and a new treatment being trialled with you. You have had particular difficulties in relation to your treatment for your haemophilia because you haven't been able to tolerate what would be the normal product for you.
That's right. It's just recently that I got the man-made stuff. The other one, I took an allergic reaction to it, and months and months I wanted them to retry in case it was just something that was wrong with that day, but they refused in case I had any side effects with it again, to do it. So I had to keep taking the Scottish blood plasma. That I think it was only one in Edinburgh, it was on it still. And it got to the stage where I was that scared that I'd get something else from it. I stopped taking my prophylaxis, so I wasn't taking anything at all. But then when I was getting a bleed, I was something to take. It was a catch-22 situation, so I was something to end up taking more of the stuff against my wishes. And this went on for quite a while, taking it. And I even phoned the hospital, the chap. I said, it was Barry at the hospital, he phoned the house. You've got to use this factor left here at the hospital. And this was at the time when I was refusing to take it because I was worrying. And he says, there's 20 bottles here, you'll have to take them. I says, well, I'm not taking it. I said, I don't want to put myself at risk anymore. He says, no, you will bloody take it. He says, you realise how much it costs.
And you, like Myles, have a loss of trust in the medical profession,
Yeah, totally.
and in particular in relation to the haemophilia centre at the Royal Infirmary.
Even though I put a complaint in about the staff, it was Ludlam's driftwood assays, I called them, the ones that had been there all through the Hep C and stuff. They're no longer there, but I still have no trust going up to the hospital at all. I feel, even when I was seeing the psychologist, so much of what I told her, she says she'd have to tell them. But I wanted to speak to her in total confidence. I didn't want them to know anything. So much so I held back on what I told her, because I knew it was maybe going back to the staff there.
And you both feel that what you need is some form of different alternative provision of services unrelated to the haemophilia centre in Edinburgh.
Yeah.
Definitely, we think that most people who suffer like this, they need somebody independent of any treatment I've had in the past. We need somebody to look at it with a clean slate and, assess you to what they see, not be looking at your biohazard-ridden files and what other people have said. You need someone to take you freshly on and listen to you, just, somebody totally independent of the problems
Because
you've had.
they just fob you off, you feel. That's what they do. And you see a lot less of them now because it's home deliveries. I've not had an appointment for over a year, and it used to be every 6 months. So I think they've washed their hands of me.
Myles, you've touched already on the effect that what you've described has on your family life and private life. Your first marriage ended. You have your happy second marriage. Mm-hmm. But you talk about having a fear of infecting your wife and about your daughter worrying about you a lot.
Yeah, my darling wee girl, she's a very bright, intelligent, lovely girl, but unfortunately this all came out that it was good for us, but not so good for my wee girl, because like a lot of girls with her dad, she worships the ground I walk on, and she worries about me, and she missed her exams, everything. She was that scared of not being in the house when I'm around that she would miss me if something happened, and that she is so scared of losing her dad because she hears all this, and that's why I've held back in the past saying things, because I didn't want them to get hurt or worry about me. I've reassured them I don't plan on going anywhere. I love them and I'll be with them as long as God permits, but it's definitely taken its toll. He always worries, where's Dad if I'm not about, and my wee daughter, she missed her exams and she's suffered a lot.
And your wife had to give up her work. She worked as a care assistant.
Yeah.
To help support you. Other than your wife, you say, and your brother, you say you don't really have any friends with whom you socialise.
Not really, no. Facebook, like everyone, we've got friends, but the people that I used to call friends and, maybe socialise with, they're all gone. They're all... A lot of the friends I thought were friends weren't really friends when I look back on it, but, I've lost all that, and my best friends, my family, they're my best friend, and I've lost all that, and I actually really enjoyed human company. It's nice to talk to people that you don't have to talk to, that are around you all the time. We all enjoy that. And I miss it an awful lot. I liked, if I was doing my job, I was able to help somebody or make somebody's day a wee bit easier. It always made me feel good about myself. And I've lost all that, it's gone.
In terms of your job, you worked in the civil service from November 89 onwards.
Yeah.
But that employment came to an end in 2002 because of your ill health.
Yes, that's correct.
And you say in your statement that's contributed to a loss of self-respect and feelings of worthlessness.
Yeah, it has. Because we all know how society judges people. We make out that it doesn't, but it does. And I took pride in going to my work, getting a pay, my pay at the end of the month, paying my bills, seeing all the brown letters and going, is it worth it? But at least you know that you've done it, you've contributed to the people around the society you live in. You're a part of it, a part of the cog. The cog in the wheel as such. But now, my brother worries about it as well. People look at you and think, that he's never at his work. He's always in his house, an arse scrounger, an arse blooming sponger. And I wouldn't mind if they were chucking money at us, but that's not the case.
You receive disability benefits. We'll come on in a moment to a recent development in that respect. But you've said in your statement that you struggle financially as a family. You've mentioned in the past when you did get some funding, some money from the Skipton Fund, you took the kids to Disneyland Paris, but you couldn't afford travel insurance for yourself.
No, I got a crazy quote. It was silly money, hundreds and hundreds of pounds. And even then I had certain conditions on it. So I'm afraid I just had to take a gamble. I didn't want to disappoint the kids, and I went with just my NHS cover that you always take. But
And then there's been a recent development in terms of assessment of the PIP assessment by the DWP. Mm-hmm. What can you tell us about that?
I was on the higher rates of DLA because of all my problems with my joints, etc. And I had my mobility car, and obviously this PIPS came in and asked me to go for an assessment after I sent an application. I went to the assessment, and it was a young chap. I don't know what he's. My wife actually asked him, "What is your medical, profession qualification?" And he says, "I'm a healthcare professional." And that was his answer. Anyway, he wanted to examine me. He wanted to examine my legs, and I said, "No point. My legs are knackered. You're not like what you see." And he started making me move my arms about silly ways and that. Anyway, the next day I ended up with a bleed because of it. That was fun. But we were in there for hours and hours, and I got my assessment back, and they've took my car off me. So I don't know how they'll expect me to get to appointments for the hospital and that.
You were on the high level.
I was on the high street.
Assessed down to standard.
Standard rate, yeah.
And that's going to mean the loss of your mobility car.
Yes.
That's what you rely upon to get out, to go and visit your mum, to take the kids to school and the like.
Yeah, everything I do relies on the car because I can walk short distances and I look fine, but I start to get really sharp pains up my legs and in my back, so I rely on the car. It's my lifeline to the world because I became a house dad and my wife worked because of my illness. I say, I'll be the one because I'm toiling, I'll be the dad. And I loved it. The best thing I've ever done. The hardest job I've ever had, but the best job I've ever had. And the car's my only way to get to appointments, things like that. Because, to be honest with you, even being here now, my brother and I were both bags and helps because we've lost the ability, a lot to be out in public, do things ourselves. It's amazing how quickly you get stuck in the way of being in your house, and the car's a lifeline that you can go here. You go here, there. And they've also cut my support money down because my wife looks after me now. I don't know how that works out. She doesn't work, so she's there to help me with things, so I don't have to be able to do it. The questionings were ridiculous.
And you're concerned, amongst other things, that the stance that's been taken in relation to your assessment contravenes assurances that have been given by the DWP to Diana Johnson MP as co-chair of the APPG.
That's correct, yes.
And you've seen a copy of an email. We don't, I'm afraid, have a copy I can display on the screen. So I'll just read out the relevant bits that you've drawn to my attention. It's from James Wolfe, Director, Disability and Housing Support, addressed to Diana Johnson. And I'll just read the bits that are relevant to the issue that you've raised, Myles. It says the department, along with PIP assessment providers and stakeholders, has implemented new guidance on haemophilia and haemarthropathy to ensure health professionals assess such cases appropriately. And then it says this: the severe conditions guidance in ESA and PIP ensures that claimants who currently receive the highest level of PIP entitlement, which you were receiving,
Yeah, well,
or are in the ESA support group and whose needs are unlikely to improve, are placed on ongoing awards preventing unnecessary reviews. Claimants affected by contaminated blood who meet these requirements will be entitled to an ongoing award.
That's correct.
And you don't think that's happened in your case?
Not at all. I shouldn't have even been assessed because I'm in the support group for ESA. I've already went through the humiliation of being asked a million questions that aren't even relevant, and I should have just been rolled right onto the new benefit, but they're not following the rule guides. And there was a helpline in that it guided you towards a helpline, and I phoned the helpline, and it doesn't exist. It says this line is not in order. I phoned it about a dozen times, and then I waited. Like anyone that phones PIP, it takes you about 40 minutes to talk to someone. I went back on again on the phone, and they said, we've never heard of this. Eventually, I spoke to a manager. Luckily, my experience in working in an office got me somewhere eventually, and she says, oh, we're going to have a look at your claim again anyway, and I'll put this statement from Mr. Wolf down, and hopefully somebody that knows something about it will see it. So it's in the lap of the gods now. I don't know what's going to...
Myles, the final thing I wanted to ask you about before I turn again to Paul was just about the observations that you've made in your witness statement about the Scottish Infected Blood Support Scheme. You've said in some respects things are better with the current arrangements than they have been previously, but you identified two concerns you continue to have. Firstly, the disparity with what was provided to those who lived in the Republic of Ireland continues to anger you.
Mm-hmm.
And secondly, you say that there's now nowhere to go to make specific applications. There's no fallback emergency provision as there used to be with the Caxton Fund.
That's correct, yes. What is I believe that we all, as British people, should get the same money. I mean, it's ridiculous what they've done. You know, sometimes one's getting less than the other, and then they flip it around again. In Scotland, it looked like we were getting a big hand up. But we used to get, you know, payments for the cold weather, things like that. Your kids' uniforms paid for. You know, you could apply for all these different things. Me, myself, I got a new house at the beginning, and it was a council house, so if you've not got a fence, you have to find one. So I'd asked them for help, and it was expensive. But they'd done a job like that for me. You know, they got all done for me. And in Scotland now, if you're getting any form of support, you can't apply for anything. If you're on stage 1 or stage 2, I mean, they've totally wiped it out. You have to be a poor soul that's getting nothing to be able to apply for things. And although we were getting a lot more money than we used to get, which is great, it's still average wage. You know, it's not as if they're giving us the world. And we've not got access to, you know, credit the way other people have because we don't work. So we have to have somewhere to go to for that, and it's just not there. You know, we can't even ask for a loan from SIBS or anything like that. I think we should all be on the same thing. In Ireland, it's strange how it's so close, but they dealt with it fairly right from the beginning. You know, it was like, we've infected you, this, so you get a lump sum and ongoing support. And they're still getting well more than anyone in this island. You know, they're getting a lot more. And I just feel we've been, I think, it's going to sound very cynical, but I think it is. I think it feels like they're just waiting as long as they can till there's none of us left to worry about. And it'll be a hell of a lot cheaper than, you know, doing the right thing, because they've just evaded the question. You know, governments have all promised they'll do this, that and the next thing, and none of them have. None of them have kept their word. Politicians have been elected saying they'll do this, local MPs, and I just feel we've been left to rot.
Paul, you too had to stop working because of your ill health.
Yes.
You have, and your family have struggled financially.
That's right, aye.
You talk about, in your statement, feeling worthless. People look at you, they wonder why you're not working because they can't see what's wrong.
Yeah, it's invisible disability, and it's when I go out the door and my wife gets annoyed with me because when I go outside, if somebody looks at me, I'm paranoid that people that know me or see me that's going into your car, oh, how's he got a car like that? Oh, he doesn't even work, eh? Look, lazy so-and-so, whatever, scrounger off the state. I've worked since I was 15-year-old and brought up that way, always wanted to work. And since I've stopped working, I feel worthless. I've lost my identity altogether. I'm just another number sort of thing feeling.
In terms of the impact upon your family life, you say that one of your regrets is you haven't been able to play with your children as much as you would like because you have just been too tired.
Aye, that's right.
You worry about your wife becoming infected,
Mm-hmm.
and your children, like Myles's, worry about you.
Yeah.
You've described in your statement, Paul, comments that you had from a dentist on one occasion. Can you recall that?
Sorry.
Comments that you had from a dentist on one occasion.
Yeah.
A dentist making a comment about throwing away the instruments after treating you.
No,
If you
but
don't
the
remember it,
dentist
don't worry.
chucking away the instruments that they used to because of hepatitis.
Well, that's right. It's because of the hepatitis C, they would have to destroy the actual instruments that they'd used in me, and how much the cost again, similar.
Those are the questions I have for you both, but I'm going to ask Mr. O'Neill and Mr. Dawson if there's anything further they'd like me to ask.
That's horrible, that. That's why I just actually must be that.
That must have been. Was that long ago that was there? Must have, I've got
The
the
first mind. She's trying to protect her. And I thought it was done to her.
There's just a few points. First of all, Myles, we talked about the hexagonal device.
Yes.
And I understand from Mr. Dawson that was used on you not once but twice. Is that
Twice,
right?
I remember, yes.
And then there is a particular concern you have about missing medical records. Is that right?
Yeah, big concern. When I got my notes, most folk would think, God's sake, it was a massive box with reams of documents. But I thought, that looks awful wee, because whenever I was in the hospital, it was a blooming trolley that used to come up with Hutchison, it was all me. And, you know, that, and the box I received was about that. And all the time, from I was a teenager right up to a certain point are gone. Years and years of men. And being a haemophiliac, you think that previous history would be very relevant. You know, you wouldn't destroy notes, but I do know that notes were destroyed in an inappropriate manner. I went to the Old Royal Infirmary for an appointment, and I became very friendly with the receptionist. And she said to me, Myles, I shouldn't tell you this, but I have to. My conscience is getting me. She goes, Arma, one of the nurses, is up the stairs just now, and they're up to something. And I went, what? She goes, they're destroying your notes. I says, maybe it's just old ones they're getting rid of. She goes, no, these are notes you have to keep in your records. Anyway, I went and seen the nurse when I went through for my usual gallons of blood tests. And I says, why would you destroy my notes? The receptionist said, she goes, well, she should mind her own business in the first place. And she goes, they're getting transferred onto CDR. You know, at the time it was CD disc, I think. And they're not relevant. It's just notes that we keep aside, you know, for the doctor's comments, things like that. And I says, all right, so there's not going to be a big space in my files or anything. She goes, no, it's nothing like that. And so when I got my medical files, I wasn't surprised when there was a massive gap, because it was happening right in front of me, basically, while I was attending Old Royal Infirmary.
And was that in the early 90s?
Yeah.
Paul, were either of your parents ever offered any counselling or psychological support or practical support?
None at all. They were just left to their own devices.
There is in your records, Paul, a reference at one stage to you being offered a SNBTS product that wasn't made from Scottish donations,
That's right,
but from donations elsewhere. What can you remember that?
Well, they had, obviously the stock, whatever they had, they didn't have anything left, but they gave me this stuff, and I took it home, and I actually phoned my brother because I had started mixing it, and it was just fully like floaters inside it, and parts of the rubber seal had all fell inside it as well. And I actually got you to look at the bottle, so I didn't take it because it just looked well dodgy. Aye.
And when you phoned the hospital, they expected you to inject it?
Aye.
Yeah.
Those are the questions that I have. Is there anything that either of you would like to add?
Yes, we'd both like to say something.
Yes, of
That's
course.
okay. Oh.
It's just Sir Brian, can I start by thanking you for chairing such an important inquiry and being so compassionate throughout the oral hearings. We are here today fighting for the bereaved, the living, and families that have been torn apart through this horrific disease that has caused so much hurt and pain to all. All we want is answers to why it happened and why we were treated as guinea pigs, why medical records were destroyed, and now why haemophilia centres no longer seem to want anything to do with us. Is this because they have run out of tests to do on us, or is it because they are running scared as they've been found out? All my life I've been treated differently. At school when the AIDS advert started, that's when I got hit hard, along with my brother, getting called gay, scum or junkie, or people writing things about us on walls, etc. Even family members who I will not name wouldn't cuddle us or kiss us. I wouldn't have minded, but we didn't have AIDS. We wondered why we were being treated in this way. So much so, till this day, I still panic if I cut myself and my children or wife get anything on them. And in my mind, infecting the people I love more than life itself. People made me feel dirty and diseased. Then we were hit with Hep C and vCJD. This made me more wary of having relationships, as I would have to explain everything and hope they wouldn't stop wanting to see me. I started Interferon, which I was told I would get flu symptoms and would be able to continue my employment at the Royal Infirmary of Edinburgh Clinical Biochemistry Lab. Unfortunately, they were horrendous. I became so depressed I wanted to kill myself, as I'd had enough. My poor mum and dad would not leave me alone in case I tried to commit suicide. I lasted a course before refusing anymore. That's when they told me it's dormant. They said it was inactive, but in the future may become active again, and the chances were I would die of liver cancer. You can go home now, they said. No support whatsoever throughout our treatment for my brother and myself and my parents. The outlook given to us was a horrible death. So much so, after seeing liver specialists that told me I'm clear, I said I don't believe you. And seeing a psychologist for over a year to one day sit with her and say, I'm broken, it's embedded in my mind and my DNA, I'll always feel worthless and diseased, and like I'm living on borrowed time. There's nothing you can say that will change this. Fortunately, I met my true love of my life, Elizabeth, the same girl that knocked me back at my brother's work party when I was 18. But I was to get another chance many years later in life. When I got employment where she worked alongside my brother. I asked her out, and this time she said yes, and the rest is history. She gave me 2 beautiful children who I love. Who I love to infinity and beyond. I was that worried about dying that I forgot how to live. Sir Brian, I hope and pray everyone involved gets the answers and closure we need to start living our lives before it's too late. It's already too late for so many, so please deal with this as quickly and efficiently possible. Thank you from the bottom of my heart.
Sir Brian, like my brother, I'd like to thank you so much. I've had the pleasure of speaking to you. You're a very compassionate and basically a gentleman, and I really appreciate you giving me this opportunity to speak. I am just one of the many who have been affected by this disgraceful bloodstain on this great country's history. But what happened to me and others like me should never have been. For decades, we have been let down by government after government and told what happened to us was unfortunate, but never any blame really accepted. As a child, I watched young men die knowing I was the same and wondering when it would be my turn. Before I was 30, I had lost a wife, a home, a job, and my dignity. But instead of being told why I was like this, I was left to feel it was all my fault and I was a failure. I struggled with the guilt of still being alive when so many I knew died, and I felt that others who had died deserved a life I had failed so miserably in. So much so that I tried to take my own life on more than one occasion, coming very close more than once. But I was blessed, and against the odds, I found love once again, where I met, like my brother, love of my life, I think we're going for points, and was blessed with two beautiful children. And although we struggled with money due to my inability to work, we were blessed with love and a true feeling of what a family should be. So many young people have died not having the gift of finding love and having a family who should have. So for this, I am truly grateful. I am telling you my story as much for those who can't as myself, and believe in doing so, I am honouring their memory. I still feel guilt for being alive. I can't help it. Every night when I lie in bed, I wonder how much time I have left, and having a recurring nightmare of lying on my deathbed saying goodbye to my wife and kids. I wake up every morning in pain, both mentally and physically, and struggle to be the man I want to be. I have trouble with intimacy because I feel I am a danger to those I love. My medical files make sure of that with the biohazard warnings. The truth is, we were lied to, and information we were entitled to know about our own bodies withheld by those who were meant to protect us. People talk about proof of wrongdoing. We and those who are not here are the proof. How can so many tell the same story without it being true? We were let down, and still are, by the NHS and the governments that are meant to serve us. In the past months, I have witnessed true heroism by the affected, their parents, spouses and children who have had the courage to tell their stories, no matter how painful. You are all heroes and have acted with a dignity and grace that shames those who wish to silence us. But you will never silence us, for once we are all gone, those who love us will take up the fight until justice is served. You know who you are, and I pray come the day of your judgment by our Lord, you finally feel the pain you have caused. You may have used the system to evade justice, but you can't avoid your own fate. We have been left to struggle financially for decades and have never been compensated for the loss of earnings and ability to own a home that we have had taken from us. Even though those who did this have enjoyed high-paid careers and live in homes of their choosing. So for my final comment, I wish to stand up for those who cannot and address those who are here representing the government. We are never going to give up, and I shall personally fight for justice until my dying breath. Those of us who are still alive deserve to live out the rest of our lives comfortably and with dignity, as do those left behind to pick up the pieces of a broken life. I implore you to tell the government that the time has come to admit fault and give us the compensation we deserve now. Just as so many other countries, such as Ireland has, and go some way to putting things right. Don't tell us there is no money, because we pay billions in foreign aid because it is the right thing to do. So surely this is the right thing to do. It is, after all, our money and all the taxpayers of this country. I stand on the shoulders of the dead, and it breaks my heart every day. And I thank you all for listening to me. Thank you, Sir Brian.
Sir Brian.
I've one question for you, Myles. Have you ever asked for the medical records of Robert Marr?
No.
I suppose I should ask the same question of you.
No.
In what I may describe, and you'll know what I mean, the straight, frank way that some Edinburgh people speak, which I know well, you have given us a dismal tale of the slow loss of trust in the medical profession, which is passed on to others, of its after effects on you personally, on your families, on your parents, particularly your mother, as testified to by that incredibly moving, beautiful letter which was read out in full, leaving you trapped by the fears of what is possibly yet to come, and by feeling that you have lost all value, though plainly you haven't, because you've found value, each of you, in your marriages. And it's amazing that even in that, you are, as it were, almost two peas in a pod. You both have two children, and you both say very similar things about your new loves. But can I just say this in particular, picking up on something you said, Myles, if I may? You said at one stage that you'd lost, you weren't the same person you were no longer the person that would help the wee lady off the bus or help someone with the messages. Well, what you have done today, as I think you recognised in what you said at the end, is you have stood up, literally, for others. The evidence you have given is important. It's particularly important because the two of you have such shared experiences, one reinforcing the other and paralleling the other. It is very valuable indeed, and I've been privileged to listen to it. So you have, in what you've been doing, been helping, even though you may think that you no longer are that sort of person. In my eyes, you are. And I hope that your wish, saying that coming here would get this away once and for all, may prove to be the truth. But thank you both. I'm sorry, Paul, for leaving you out of specific mention, but I think I see the two of you almost as two sides of the same coin, as it were. And I hope you don't mind my doing that.
That's fine.
But thank you again
Thank you.
for that.
Thank you, Sir Brian.
We'll take a break now till 3 o'clock.
And so the live stream will be off after lunch.
Thank you.